Hello and welcome. Today we're delving into temporal arteritis, also known as giant cell arteritis. This is a serious inflammatory condition that can have significant implications for your health, particularly your vision. We'll explore what it is, how it develops, its symptoms, diagnosis, treatment, and more. Let's begin. The exact cause of temporal arteritis remains unknown. It's believed to be an autoimmune disorder, meaning the body's immune system mistakenly attacks its own arteries. Genetic factors are thought to play a role, and certain infections or environmental triggers might also be involved in susceptible individuals. However, a definitive cause hasn't yet been identified. In temporal arteritis, the immune system targets the walls of arteries, most commonly the temporal arteries, which run along the sides of your head. This immune attack causes inflammation, which leads to swelling and narrowing of the affected arteries. This narrowing reduces blood flow, potentially leading to tissue damage and serious complications. The inflammation is characterized by the presence of giant cells within the artery walls, hence the name giant cell arteritis. Temporal arteritis primarily affects older adults. It's rare before the age of 50, and the risk increases significantly with age. The average age of onset is around 70. It's more common in people of Northern European descent, and women are affected more often than men. While not directly inherited, a genetic predisposition is suspected. The signs and symptoms of temporal arteritis can vary. The most characteristic symptom is a new onset of headache, often severe and localized to the temples. Other common symptoms include tenderness along the temples, jaw pain when chewing, claudication, visual disturbances such as blurred vision, double vision, or even sudden vision loss. Some individuals may experience fever, fatigue, weight loss, and muscle aches, particularly in the shoulders and hips, a condition known as polymyalgia rheumatica, which frequently occurs alongside temporal arteritis. Diagnosing temporal arteritis requires a combination of clinical evaluation and diagnostic tests. A doctor will assess your symptoms, perform a physical examination, and order blood tests to check for elevated markers of inflammation, such as erythrocyte sedimentation rate (ESR) and C-reactive protein 6-CRP. The gold standard for diagnosis is a temporal artery biopsy, where a small piece of the temporal artery is surgically removed and examined under a microscope for signs of inflammation and giant cells. Ultrasound of the temporal artery is increasingly being used as a non-invasive alternative or adjunct to biopsy. Temporal arteritis is not typically classified into distinct types. However, it is often considered in the context of its association with polymyalgia rheumatica (PMR). Some patients present with primarily temporal arteritis symptoms, while others primarily exhibit PMR symptoms. Many patients have overlapping symptoms of both conditions. The presence or absence of PMR can influence treatment strategies and overall management. The primary treatment for temporal arteritis is corticosteroids, such as prednisone. These medications are highly effective at reducing inflammation and preventing serious complications like vision loss. Treatment typically starts with high doses of corticosteroids, which are then gradually tapered down over several months to years. In some cases, other immunosuppressant medications, such as methotrexate or tocilizumab, may be used in conjunction with or as alternatives to corticosteroids, particularly when steroid-sparing effects are desired. Regular monitoring by a physician is crucial to adjust medication dosages and manage potential side effects. Currently, there are no proven methods for preventing temporal arteritis. Since the exact cause is unknown, preventive measures are difficult to implement. However, maintaining a healthy lifestyle, including a balanced diet and regular exercise, may contribute to overall immune system health. Individuals with risk factors, such as being over 50 and of Northern European descent, should be particularly vigilant for the signs and symptoms of temporal arteritis and seek prompt medical attention if they develop. With prompt diagnosis and treatment, the prognosis for temporal arteritis is generally good. Corticosteroids are usually very effective at controlling the inflammation and preventing vision loss. However, long-term treatment with corticosteroids can have significant side effects, such as weight gain, bone loss, and increased risk of infections. Therefore, ongoing monitoring and management are essential. Recent research has focused on developing steroid-sparing agents and identifying biomarkers to predict disease flares and optimize treatment strategies. Newer biologic medications like tocilizumab have shown significant promise in reducing corticosteroid dosage and improving long-term outcomes.